Hi, I'm Dr. Jay Burness. Today I'd like to show you some of the functional problems we see that are causing many of the symptoms of PCS. So the most common issue we see in almost all cases of PCS is a loss of adequate gaze fixation. This can drive headaches, blurry vision, and dizziness for many patients. So simply put, gaze fixation is the ability to hold your eyes steady on whatever it is you're looking at. In order for your vision to be clear, you have to keep what you are looking at on a very small spot on the center of the retina called the fovea. This is where our vision is the sharpest. It's also where the cells are that let us see colors. If your eyes move slightly, even less than 2 degrees, and the target slips off that fovea, your vision will blur and your eyes will make a quick corrective movement called a saccade to try and bring the target back onto the fovea. How often these slips and corrections happen can drive a lot of PCS symptoms. So these movements are small. They're hard to see with the naked eye, and most doctors are not trained or properly equipped to see them. Most patients can't feel them happening either, and they certainly can't see them in the mirror, because when they're happening, their vision is poor. In our office, we use a sophisticated camera system called a video nystagmograph to record these and other eye movement issues that are common in concussion and dizziness disorders. So let me show you what this looks like. Here are the eyes of a normal person staring at a dot projected on the wall in front of them. And here's a PCS patient with symptoms of headache and dizziness. So there's a few things to notice on this slide. First of all, can you see the movement? Here it is, again, again. So ideally his eyes should be holding still. He's just looking at a target straight in front of him. So there's that. And then the other thing you notice as well is if you look at his eyelids, the left eye here, you can see the eyelids just at the top of the pupil, and on the right eyelid, the eyelid is well above the pupil. So this guy actually has a left-sided ptosis. The eyelid is hanging low on the left side, and he's working very hard to keep it up. Normally the eyelid should sit at the top of the pupil just like that. This one is way high because he's working so hard to get the left one up, he's pulling the right one up higher than it should be. So this is a left-sided ptosis, which is quite often seen in brain injury as well. So anyway, when you're looking at this guy, again, this line down here in the bottom, this is an actual graphic representation of his eye movements. If the line's going up, his eye's moving to the right. If the line's going down, his eyes are moving to the left. And ideally, this line should be straight. So we can see he actually has a fair number of movements here. So this is quite unstable in terms of gaze. And again, this guy's got headaches and he's got dizziness associated with his concussion. And if we look at the statistics on this, you can see that he actually has a total of 58 movements of the eyes inside of the 30-second testing period, which is a lot. Upper range of normal, again, is about 15 of these movements in a minute, and he's actually got 58, 116 in a minute. So that's significantly unstable. There's no wonder this guy's got difficulty reading and his balance is off and he's got some headache. So it's important to realize that this testing is done when he's looking at a target that's holding still. And things could be way worse for him if he was trying to follow a moving target. These movements are even worse if you're looking off to the side, away from center, like towards the ends of a sentence on a page or a computer screen. They make for a lot of extra work for the eye muscles, and they can drive headaches. If these types of movements happen often enough, they can even generate dizziness and vertigo. So another thing you see here is that this guy is blinking a lot. And this is something that we see quite a bit as well with gaze instability, because when you lose your focus, you're naturally going to want to try and blink or close your eyes and open them back up again to re-establish focus again. So it's a real good indication of stability issues, severe ones like this one, if you notice that the person blinks a whole lot. This is just one of many different types of eye movement control issues we see in PCS and in other brain injuries. The type of problem and the direction of eye movement can tell us which areas of the brain were affected by the injury and which specific exercises and stimulations may be able to help. Here's that same patient after doing some specific exercises for this issue. You can see that the number of eye movements have been reduced by a little less than half. He's not perfect yet, but at this point he was feeling a lot better and he was able to return to work. Issues with following eye movements called pursuits and the accuracy of jumping eye movements used in reading called saccades are also seen in PCS, and I'll show you some of those next time. In the meantime, here's a simple test you can use to test your own gaze fixation abilities. Stare at the red dot in the center of the screen here. If you have good gaze fixation, you should see that the green circle will disappear after a few seconds. The better you can keep your gaze fixed on the dot, the longer the green circle will be gone. Now remember, nobody can hold their gaze steady forever, but if you can't get the circle to disappear at all, then your eyes are moving more than every few seconds, and your gaze fixation isn't great. So that's it for this video. Please tune in for the next one, and thanks for watching.